Do you understand what a PPI is? Do you understand the problems with PPIs and the history of PPIs? You might actually be causing yourself more heartburn and more problems based on the fact that you continue to take a PPI that you shouldn't take. Let's get into it. Here we go. Right in my wheelhouse. What are PPIs? What do they stand for? PPI stands for proton pump inhibitor. This is the #1 medication prescribed in the United States. #1. Not a heart medication, nothing related to cancer, nothing related to weight loss, not Ozempic, not even close. PPIs, #1. Why? PPIs reduce stomach acids. What are they trying to treat with that? Of course, things where stomach acids are a problem. Heartburn or GERD, acid reflux, where acids are moving up into the throat. EOE, we talk about that on a different video. That's eosinophilic esophagitis, that's in the throat, connecting the mouth to the stomach, that's getting inflamed. These type of conditions are used or treated with PPIs. Here's what's amazing. When PPIs came out, and this is back about 25 years ago when they were coming up with something stronger than like Tums, antacids like Rolaids, that sort of thing. They wanted to find something that was stronger for patients who, after surgeries or something involving the stomach, they really needed to reduce the stomach acids, but temporarily at the longest, meaning 4 to 8 weeks at most. The Gastroenterology Society back in 2003, this is 23 years ago, said these should never be used for more than 4 to 8 weeks. That's it. If you've been on a PPI for more than 4 to 8 weeks, I bet if you're watching this video you have, or somebody you know who you care about has been. This is what's happened. The cause of heartburn or GERD or acid reflux or EOE, the causes they vary. And doctors don't dig enough. Traditional medicine does not do a great job digging deep under the surface to figure out why is this going on. They're only looking to do one thing: mask it. Quick fix, in and out, there's a pill, see you out the door. That's why you're watching this video, because that either bothers you or somebody that you know is doing it, and that bothers you because you think that there's something else causing it, and you're right. So when we're talking about PPIs, this is what they are. Now, there's 2 different types I do want to mention. Proton pump inhibitors are divided into the actual PPIs. Those are things like pantoprazole, omeprazole. You've probably heard these terms before. Or they're H2 blockers. PPIs are the ones that actually reduce the stomach acids, the omeprazole, the omeprazoles. H2 blockers, they're actually designed to reduce histamine. And histamine is another thing, it's another molecule or chemical released into the stomach that further produces more acid. So it's kind of like a secondary acid maker. And so if you go on a PPI and you're getting heartburn, they might throw a second PPI on there, or they'll double your dosage of this and add in an H2 blocker. Like a Tagamet is a good example of that. Zantac, Pepsid AC, these are H2 blockers. So if you're taking those and you're taking omeprazole, you got the double whammy. And I imagine that if you've been on one, you got somebody that you know who's been on one, they're supposed to be on it forever. There is no plan. The doctors don't say, well, we'll see how you do in another year, maybe we'll take it off you. The doctors write that prescription, out the door you go, and they expect that you will be on that forever. That doesn't seem right, does it? We have to reduce stomach acids for the rest of our lives to fix this problem. Don't we need our stomach acids? Why do we even have stomach acids? These are all questions that are very important to answer. And this is why people are still having this problem, and why you might be watching this video. So I recommend, if you're dealing with this cycle of medication, repetition, and the doctors are expecting you just to be on this the rest of your life, go to the link in my description for this video. In there, there's an opportunity for you to sign up, do a free call with us, 15 to 30 minutes, no charge. Sit down with us and ask some questions. We're going to want to ask some questions about you. What's going on with you? Are you a good fit for our office? And vice versa. Are we a good fit for what you need? And the questions you might have, or will get answered on that call. But this is what we do with functional medicine. Because traditional medicine has got this dialed in. And this may help some people. But we were never meant to be on this for months, years, decades. I have patients that come to see me. They've been on this medication for 25 years plus. Basically, since the medication came out. They were just like, here, we got something that you can use. Be on it for the rest of your life. And that's unbelievable to me. So go to the link, take advantage of this offer. This might be exactly what you're looking for in terms of how to deal with these PPIs and finally solve your heartburn for good.